Actually, in more than half melanomas, there's a mutation that's in a gene called BRAF or BRAF that leads to too much cell growth and too much growth that's happening quickly. So therefore, there are already drugs out there that target BRAF and make it so it kind of shuts BRAF down and therefore causes cell death of cancer cells. The stage of your cancer refers to essentially the severity of the disease. In the case of melanoma, the different stages go from 1 to 4, where the first one, stage 1, is a melanoma that is localized to one area. So let's say I have a mole here and my melanoma is just in this one mole in the top layer of my skin. So that would be stage 1. Stage 2 melanoma is if I have this mole localized in my skin, but instead of being just the very top layer of my skin, it's actually bigger and it is going deeper, depth-wise, into my skin. Stage 3 and 4 melanoma refer to when the cancer cells in the skin that started in this one singular mole have now moved to other areas of your body, such as the lymph nodes or your lungs or your liver, and other areas of the body are also possible too. And of course, we know with cancer, the earlier you tend to catch it, the better. So if you can find melanoma when it's really early here and it's just in one localized area, the treatment can very often be just removing it. Doctors will go in and just take a big excision and just remove the mole as well as some skin around it to make sure that they get all of the cancer cells. And very oftentimes, if you find it early like that, your chances of getting rid of all the cancer cells are very high, and therefore you are cured of cancer. So really highlighting the importance of checking your moles, finding them early, and if you have a melanoma, getting it removed as fast as possible before it has a chance to go deeper into your skin or move to areas of your body. With stage 1 and stage 2 melanomas, sometimes depending on the depth and how big the tumor was initially, your doctors might also recommend you to go on something called an adjuvant therapy, which means a medication that you take after surgery. And that's just to hit your body with a little bit more of cancer-killing medicines to make sure that, although they did remove the tumor, that all the other possible cancer cells that were left over are also being killed by this type of treatment. If you have stage 3 or 4 melanoma that has metastasized or moved from the initial location to other areas of your body, the treatment tends to be a lot more aggressive. Sometimes with stage 3 and stage 4 melanomas that have metastasized, some of them can still involve surgery where you can remove the initial tumors, but some of them you're not eligible for surgery. And so your only option is to do systemic types of medications. So there are a lot of different treatment options for melanoma, and scientists are constantly trying to find better options that are safer and have less side effects, and also do a better job at shrinking your tumor and managing your cancer. So some of the ones you might hear about for treatments for melanoma are chemotherapy. And chemotherapy is a certain type of chemical agent that kills fast-growing cells in your body. And as we know, cancer cells are very fast-growing. And so therefore, chemotherapy is a very excellent way of killing cancer cells. And there's also a lot of other technologies that are coming out that are more kind of targeted to cancer cells. One of these ones is immunotherapy. And immunotherapy is essentially a way of just harnessing your immune system to boost it and be able to find cancer cells. So as we know, our immune system is a very excellent finder and hunter of all things foreign in your body that aren't good for you. So in this era of COVID-19, we know about our immune system being able to fight against viruses, but your immune system is actually good at also finding cells that are damaged and that need to be killed. Cancer cells, though, they're not like foreign invaders like bacteria. And cancer cells can kind of disguise themselves and put a mask on and pretend like they're healthy cells. And so they can kind of try and trick the immune system to leave them alone. And so that's why immunotherapy is useful, because scientists can essentially help your immune system kind of train it to be able to find and identify cancer cells and be able to pull back the mask and fight and kill them anyway. And so there are now therapies that are available, such as interleukin-2, which is a very common immunotherapy that's very useful at treating individuals with metastatic melanoma. The other really exciting type of therapy that can be given to patients with metastatic melanoma to help control their disease is something that's called targeted therapies. So in patients with melanoma, there can be certain mutations or changes in genes that are broken in patients' cancer. And these genes that are not working properly can help drive that cancer to grow and cause it to grow fast or not die when it's supposed to. So, what scientists have done is they've done a lot of research into determining which genes are involved with cancers, which genes are involved with melanoma, and then finding ways to actually use medicines to target those genes and try to make them work properly again, or try to destroy them so the cancer can't continue to grow and use that gene to drive its growth. So actually, in more than half melanomas, there's a mutation that's in a gene called BRAF or BRAF that leads to too much cell growth and too much growth that's happening quickly. So therefore, there are already drugs out there that target BRAF and make it so it kind of shuts BRAF down and therefore causes cell death of cancer cells. One of the drugs that is already FDA approved and being given to patients currently that is targeting particularly that one gene that can often be involved in patients with melanoma is called vemurafenib. And this is a drug that is really successful, and targeted therapies are really great because it's targeted to specific things that are going wrong with cancer. And so therefore, it tends to have much less side effects than treatments like chemotherapy. So we know chemotherapy can cause hair loss and nausea and vomiting. And so it's very effective, but it can be a difficult treatment for patients to go through in terms of side effects. And so it's very excellent that research is advancing cancer therapies in all these ways that give us an arsenal of different treatments like immunotherapy and like targeted therapy. And so every patient can have a little bit of choice, and doctors that are helping patients can have an option to think about of what different treatments would be best for them and their cancer. Aside from the treatments that are already out there, what is always important to remember is that those treatments we have now were tested in clinical trials previously. And so, in that same vein, there are also lots of clinical trials that are going on right now that are trying to figure out new and better and different ways of treating melanoma. Currently in the United States, there are 101 melanoma trials that are currently looking for patients to enroll that are looking at some of these new different therapies. And so now we'll move into talking about what a few of these clinical trials are doing. It's also really important to not only have one drug that's an immunotherapy drug to treat melanoma, but rather multiple different types of immunotherapy drugs. Because one of the things about cancer is that it's extremely resilient and pesky, where you can treat it with a certain immunotherapy drug that will work for a time, but then the cancer will evolve and find a new way to hide itself from the immune system. And so we need to have different ways of targeting the cancer cells. So, for example, there is one clinical trial that is currently recruiting participants in the United States that is trying to figure out if they can add a new drug that's being tested in clinical trials to a drug that's previously been FDA approved and is currently being used to treat patients with melanoma. So the idea is if they add this new one to the one that's already out there, can the combined effects of these two immunotherapy drugs do a better job at shrinking cancer cells? So the idea is if you're attacking the cancer cells from two sides, is it more effective at shrinking the tumor? So this trial is currently recruiting patients with metastatic melanoma. An example of a clinical trial that is currently recruiting patients for a vaccine trial, which is another way of doing immunotherapy, is one that I'd also like to mention because I think this is a really exciting way that we are using immunotherapy to target and treat cancer. As I mentioned previously, cancer cells can do a lot of things to kind of try and trick the immune system and pretend like they're healthy cells. But like foreign invaders, like viruses and bacteria, cancer cells do have small, unique markers that are different than healthy cells that will actually be specific to each person's tumor. So, in this specific clinical trial that's currently recruiting in the United States, the doctor will first have you come in and they will sequence your tumor, which means that they will look at what the DNA looks like and what the genes are looking like in that tumor. And they will figure out the neoantigen, which means the little bits of the cancer markers that are different from healthy cells. And then using that, which is specific to you, they will try to create a vaccine that teaches your immune system to identify that specific neoantigen that they found on your specific cancer cells. And so when they give that to you in a vaccine, that it primes your immune system to be able to identify that specific neoantigen and kill your specific cancer cells. I wanted to bring up this example because I think it really highlights how personalized and amazing cancer research is becoming. We're trying to find new treatments that give us lots of different ways of treating melanoma, which gives us more option in our toolbox to have better outcomes for patients. And I think this example really shows how personalized it's trying to become, where the treatment that they give to you will be different than they give to somebody else because your cancers are not the same, even though they're both melanoma. So I think these are just examples of two of the 101 clinical trials that are currently going on in the United States. So if you're diagnosed with melanoma, a clinical trial might be the first option that's offered to you, because clinical trials are recruiting patients who have not undergone therapy all the way to patients that are currently undergoing therapy, and even for patients who have finished therapy and they're trying to prevent cancer from coming back, for example. So regardless of where you are in your melanoma treatment, there are lots of different clinical trials going on. And so we really encourage you to have a look at what clinical trials are out there, even from an education standpoint, to see what new treatments are coming out, and am I interested in these, and should I bring up any of these to my doctor as treatment options. A lot of times clinical trials are the only place where you can get access to these new treatments that are coming out. And what's important to remember about clinical trials is that, again, the treatments you are getting today from your doctor in a hospital setting were tested in previous clinical trials before. And the reason why you have them today is because they were safe and because they were more effective at treating cancer than what was the standard therapy previously. And so if you engage in a clinical trial, sometimes you might be able to have access to something that might even be better, a better option for you than what's available currently. And so overall, clinical trials are a really great way that our scientific community is trying to get better at finding different ways to treat melanoma. And overall, we have come leaps and bounds in terms of knowing what melanoma is, how it affects people, and being able to even tailor therapies to specific people. So it's all really exciting of what's going on in this space. Overall, we hope you enjoyed this video, and that, remember, May is all about melanoma. And so we encourage you to share this video with other people in your friends or family groups, because melanoma is a disease that affects everybody. It's easily preventable. And again, if you find it early, your outcomes are much better.